Okay, thank you, Lennox. Maybe without wasting time, you know, it's a short time on Zoom, but we are basically discussing the experiences and the effectiveness of journalists as frontliners in this fight against COVID-19. So we welcome you all. We are working on this one with the Zinef, and I hope will join us shortly. So
opportunities to to say a few words, about 5 minutes each on areas that the various speakers have prepared. On our lineup, we've got Patience Ziriba, who is coming up next, and then Vivian Marara. Hopefully, Dr. Gadzikwa will be joining us. We have Itai Rusike. I can see Itai is online. And we will also have later Tumsani Mleya, and then Mrs. Victoria Ruzidzo, and Ishmael Ndlovu. Then rounding it up will be Pasmo Kuzipa. Then afterwards, we'll have our question and answer time, and then we will close. As a bit of warning, at 40 minutes, we might be cut off because of logistical issues, but be aware that 40 minutes will be cut off, but we will resume soon after. Our logistics people will be able to do that. So without much ado, let me hand over to Patience Zirima for your 5 minutes. Welcome, Patience. You can take over.
Thank you very much, Lennox. Since I've just got about 5 minutes, I won't go into a whole presentation. So I will just speak to the notes that I have. And if colleagues would like a fuller copy of our reports and my presentation, I can always send those to Media Center for circulation. Thank you very much again for inviting me to share experiences and effectiveness of media workers in reporting COVID-19. As media monitors, we're coming in from the perspective of just monitoring content, and the output of the media, what we see every day is what we monitor, and the results are what I will just share briefly. Last year, we started monitoring around March all the way up to December around COVID-19. We monitored various media in Zimbabwe and the Southern African region, where we looked at mainstream media, mostly print, electronic media, radio, television, as well as social media, and how they've been reporting on COVID-19. We conducted this research to really just assess the role that selected media are playing in terms of providing accurate, comprehensive information on the pandemic, and looking at this information as a key resource in the fight against misinformation and social stigma that has been brought about by COVID-19. We've produced a couple of reports. We've got about 3 for Zimbabwe and 1 for the Southern region. And like I said, these can be made available. During the period that we monitored, we noted that yes, the media played a very big role in terms of the extensive coverage that they gave to COVID-19. The issue was very topical, was in the headlines for months on end. Of course, here and there would find that there were some issues that would take over political story, etc. But generally, we found that issues around COVID-19 were very topical in the media. We, however, noted that there were some gaps in terms of the coverage. I'll just highlight a couple of the issues that we felt need to be addressed a little bit more by the media as we are going forward. Information is provided mostly in 3 languages, especially in media: English, Shona, and Ndebele. And this leaves out quite a huge number of the official languages in terms of really giving out information on COVID-19. Of course, one of the problems is that we don't have that large, wider variety of media houses. For example, if we've got just the ZBC as the only television station, there are limitations in terms of the number of languages they can be able to put out on the station. Of course, we did see different languages in on National FM, Radio Zimbabwe, but this was not, was way overshadowed by the use of the 3 languages that I mentioned. Women's voices, as with other stories, were very low in coverage of the pandemic. We found just 22% of all the stories, both in mainstream media, online media, social media. I'm looking at media houses that actually produce their content via social media, Facebook, Twitter, YouTube, etc. We only found that there were 22% of women's voices that would come out, and that kind of marginalizes the perspectives of women and the impact that the COVID-19 has had on their lives. We also noted that the media mostly speaks to urban, right? The urban areas, they cover urban areas, urban events, with very little reporting around what is going on in rural areas. That meant that developments in the rural areas were very few, and it was very difficult to try to have an understanding of what exactly is happening in rural areas. This, I think, impacts on the nature of policy interventions in terms of what takes precedence, who is important and who isn't. And I think this is an area that media can do better. There was also quite a heavy focus on the numbers.
The research, the voices have mainly been those of government officials. Yes, here and there, we find that we have, health officials commenting and saying something, but usually the news is centralized around government officials. And what then does that say about ordinary citizens and their sentiments when it comes to COVID-19? As the national coordinator of ZACRAS, we have been working extensively in marginalized and underrepresented communities to also cover issues related to COVID-19, where issues around language usage are something that we are very, serious and passionate about, where our focus is not only about, referring or, using the English on the languages, and that all the languages which are espoused in the Constitution of Zimbabwe are used in disseminating information so that different citizens are able to relate and understand what is being discussed. You also find that even the content focus of the work that we do is mainly related to communities' lived experiences and also hearing their sentiments on what exactly is happening in their communities. But I think what, however, needs to happen is maybe the need for stronger linkages between community media operators and also mainstream, so that the stories that we're doing at a community level find, an outlet or a space in mainstream media, so that we are also aware of what exactly is happening in the different communities which are outside of Harare and Bulawayo. You also find that the issue that was raised by patients around the content focus of, having mainly government officials. When we look at community media, the issue around the accreditation of journalists for last year posed quite a number of challenges when it comes to content access at a community level. You will then find that in some cases, community media practitioners were, strongly disregarded or barred from attending meetings, which would have been critical and crucial for them to appraise communities on what is happening in their different areas. So we're quite happy that recently there was the gazetting of the ZMC new fees for accreditation, which we look forward in taking up as community media, so that we are able to tell the COVID-19 story from a community's perspective, using local voices, local languages, so that people are aware of what's happening. But like I said earlier on, I think what is really needed is also that strong linkage between community media and also mainstream media, so that we're able to share our stories. We're able to take the grassroots stories to the to the national space, so that if there are any challenges which other sectors can come on board and assist in addressing, then it's easily accessible through mainstream media and also through the linkages that are there between the two entities. I think for now, Lennox, that will be my reaction to the presentation by Patience.
Thank you, Vivian. I think what comes from your discussion basically echoes what Patience was saying, you know, that the voices in the communities are stifled. We're hearing a lot more about the urban areas and not of the of what is happening in the rural areas. And as you are saying, things might be worse out there, and we don't have the correct picture of what is actually taking place. We are supposed to be having a Dr. Mgadzikwa right now, and community health expert. I think we also need that, you know, the expert's view about what is happening on the ground to make us understand, you know, what is actually taking place in terms of the professional aspects of the pandemic. Itai, the floor is yours.
Yes, thank you very much, Comrade Lennox, and thank you very much to the Media Center for inviting me to be part of this panel. Unfortunately, our bandwidth here is quite weak, so I may not use the video facility. But if you look at this current COVID-19 response, unfortunately, it has made, you know, communities bystanders. What has been happening is that decisions are being made at the top with very little input, you know, from the various, you know, community structures. So as a result, it is becoming very difficult even for issues of compliance, because communities are only coming in when the implementation is now expected. So the issues that are coming from the community, you do realize that communities are saying, they also want to hear from the government side, what is it, you know, that the government is going to do, you know, for the people, rather than for the government to just ask people to say, don't do this, don't get into the city, and so forth and so forth. But if you look at pandemics, you know, communities and community structures are the first line of defense. So without community participation, without community involvement, it then becomes a challenge for even the current, you know, lockdown to be a success. We should also appreciate that, you know, our social and economic factors have not been really, you know, considered in this response. We are all aware that majority of our people, they have to work for their daily bread. Most of them, they do not have any savings. Most of them, you know, they have to hustle for them to be able to survive. But if you look at the current COVID-19 response, unfortunately, it is kind of, you know, sidelining, you know, the ordinary communities. Right now, the government has said, you know, the manufacturing sectors can operate, you know, the mining sector can operate, but the small businesses cannot. And these are people who do not have any savings, which then becomes very difficult for them to stay at home, which then becomes very difficult for the general public, you know, to support the lockdown in terms of compliance. And then you also look at the issue of, you know, awareness, COVID-19 literacy. I'm not sure why there's this assumption that the general public is aware about, you know, COVID-19. There's a lot of information on COVID-19. But what we are seeing on the ground is that people still need, information on COVID-19. So as a result of lack of, credible, information, you would realize that there's a lot of disinformation at community level, to the extent that even before the vaccine comes, there's so much, information that is, floating around, where people are becoming to have, some hesitance in terms of, the COVID-19 vaccine. But this is also happening mainly because the focus has been so much on lockdowns. And then we have forgotten that the lockdown alone may not be enough. The lockdown will need to be supported by other strategies for us to be able, to flatten the curve. But we are also realizing that many urban and including rural communities in the country, lack predictable water supplies. So it then becomes also a challenge, even to tell communities to say you have to wash your hands regularly with running water and soap, when the people do not have the water in their homes. Yes, majority of the people may have taps in their homes, but when they open those taps, unfortunately, water doesn't come out. So it then becomes a challenge to continuously tell people, to wash their hands. So local authorities have also not, played their part in terms of water provision. And then you look at the issue of, our community health workers. In the rural areas, we call them village health workers. These are the cadres that have got a direct interface with the community. But unfortunately, even if you look at how the government has been supporting the mainstream health workers to the detriment of the community health workers, even the issue of PPE, most of the community health workers have not been provided with adequate PPE, even suitable PPE. They've not been also included even on the issue of the health insurance that has been extended to the mainstream health workers, the danger allowances that are being given to the mainstream health workers. But these are the people who go into people's houses every day. These are the people who are equally exposed, to COVID-19. Even their, normal allowances, sometimes they come after 6 months, sometimes even after a year. Some of them do not even have the tools of the trade, like the bicycles, the uniforms, and so forth. So without, acknowledging and recognizing, the role of community health workers, it then becomes a challenge, for us, especially in community health, to have, the support of this lockdown and the COVID-19, response. We also know that majority of our people, especially those that live in the flats, those that live in the hostels, in rented accommodation, it also becomes a challenge to talk of self-isolation. How do they self-isolate when they are living in a one room? It creates a lot of challenges, because one, they share the bathroom, they share the kitchen, and what we were hoping to see on the ground was maybe the government coming up with temporary tents, say around Matapi flats, whether Mzilikazi flats in Blawayo, so that in the event that a family member, is infected by COVID-19, then they are able to self-isolate. So at the moment, there's no self-isolation to talk about when people live in an accommodation, that is not suitable. And then you look at the focus of the response. We have, focused too much on COVID-19, to the detriment of essential healthcare services, and we have even risked, losing the gains that the country had achieved in HIV, in family planning, in TB, and malaria. Look at how many people have died of malaria since March 2020, because we have shifted our focus. And what you see right now, even sexual and reproductive health services, things like, condoms, they are not there. There's shortages of condoms. When mothers are just about to deliver, the requirements for a mother, for you to go to a maternity hospital, you need a COVID-19 certificate. And a COVID PCR testing is costing $65. So as a result, we have gone back now to the old way of mothers delivering at home, because some of them cannot even afford, the PCR testing. So the issue of essential health services, I think, needs to be addressed. We have also killed the health-seeking behavior, because what we are now seeing is, because of these restrictions, most people are now getting sick, but they cannot, because they don't have the exemption letters for them to go past these numerous checkpoints. So a lot of people, especially some with chronic conditions, they are going to miss out even on their ARV stockouts and so forth, because some of them may not have the letters, to be able to, to go past the various, police checkpoints. There are also issues of bed capacity in public health institutions. Yes, the government has come out very often saying we have got enough capacity, but the reality is that a lot of people are failing to get admitted in our hospitals because of the, our most of our COVID-19 designated hospitals are operating at full capacity. And what we hear is the political elite, because they can afford, they are going to private hospitals. And we all know the charges that are being charged in private hospitals. So as a result, the poor, unfortunately, are ending up dying at home. So even the issue of statistics, I think as journalists, we may need to unpack the current statistics that are being shared, the official statistics. These may be way, grossly underreported. One, our testing capacity, we know that is still very low. And then we also have a challenge of people, especially in remote communities. Now that COVID-19 is out there in the rural areas, we have got a lot of community deaths that are happening in those rural areas. Unfortunately, some of those are also not properly documented. And then you look at the issue of the public transport in urban areas. The government is still insisting that ZUPCO remains the only operator. But we all know the capacity of ZUPCO. ZUPCO at the moment does not have the capacity to ferry the commuting public, especially in major towns. So as a result, people end up looking for alternative sources of transport. And if you look at the alternative sources of transport, these are the pickups, the open pickups, the lorries. And unfortunately, issues of social distancing are never observed in those lorries and the pickups. As I close, I think it is also important to note that even in a pandemic, human rights issues still needs to be observed. What we are seeing at some of these roadblocks, especially in terms of privacy on someone's medical condition, we have a lot of cases that we are handling at our office, where people on art are being asked to share, to police officers who may not have a health background. What is their condition? Why do you need to go to Paranyakwa Hospital? And when they say, I want to go and collect my ARVs, sometimes they're asked to say, can you share us, can you show us the bottle, of the ARVs? So as a result, issues of confidentiality, issues of privacy are now being, compromised. The restrictions, in a way, have also affected the operations of, NGOs, civil society organizations that work in these various communities, that support these various communities, because some of them may not necessarily get the letters of support from their sector ministries. We know some sector ministries, especially if you are a human rights NGO, it may be a challenge for you to get a letter of support. If you are an NGO that is working in democracy, in good governance, it may be a challenge for you to get a letter of support. I think the only ministry that is very supportive is the Ministry of Health, mainly because health issues are seen as softer issues. And as a result, you'd find those partners that work with the Ministry of Health are the ones that may get those kind of support. And then, of course, the perennial underfunding of the health sector. we are now seeing why it is important for a country to fully fund its health sector. We are now starting to see even our political elite now that they cannot travel outside to get their treatment because of the closure of borders and so forth. It is important for a country to prioritize domestic health financing, and I think maybe this can be an opportunity for us as Zimbabwe to then start allocating additional resources to the health sector and move away from the current situation whereby the bulk of our funding is coming from donors, which then creates a security challenge like what we are seeing right now. So maybe for these short contributions end here.
Thank you, Itai. The reason why I allowed you to continue is because you had so many gems to share with us, and yeah, we have been educated, and in some cases actually been reminded of some of the issues that we are supposed to be interrogating as journalists and media workers. And that was a very comprehensive presentation, and I'm sure that our colleagues have benefited a lot, and it has also provoked them to contribute to the discussion that we're going to be holding later. Thank you very much for that. Coming up next, we are going to have a perspective from a frontline worker or a frontline media worker. And in this case, for now, we have Pasmo Kuzipa. Pasmo, can you open your mic? The floor is yours for your presentation.
Thank you very much. I will speak on behalf of Telzim News. Telzim News is based in Masvingo, and it mainly covers 3 provinces: Midlands, Masvingo, and Manicaland provinces. And one of our major objectives is promotion of access to credible information by marginalized communities. So in this case, during the pandemic, we were biased towards women and youth. So when the government announced lockdown, that was on the 31st of March, I would say we faced a lot of challenges. One, in terms of accessing information. As you may be aware, Masvingo had more than 10 cases of journalists being arrested and detained sometimes. So we had that challenge with the police. But personally, at some point, I was summoned to the acting pro post office, then Assistant Commissioner Nyazema. He threatened me and warned me not to write such kind of stories. So in the beginning, it was very difficult. And also, we had some challenges with the issue of accreditation. We were using 2019 press cards. There was serious, I don't know if it was a serious misinterpretation of the SI by the police, or it was ignorance from the security forces, because in many cases we were denied entrance maybe to some government offices when we wanted to inquire certain information. So that was also another challenge. But I'm happy as time went on, we managed to have meetings with the security forces, and we agreed and were given limelight to operate freely. Then also, because of lack of resources, we are limited in terms of resources. So it was difficult for us to go deep down into rural areas, like Mwenezi, areas like Chiredzi, Zaka, and Bikita to have a first experience there. It was really difficult due to limited resources. So in trying to counter that, we then made use of citizen journalists. We we managed to train over 300 citizen journalists in Masvingo and Manicaland provinces. Then also we had an opportunity to conduct a refresher course for these citizen journalists during the lockdown last year. That was around July, just to remind them and also to upskill them on how best we can report issues, especially during the lockdown, where there were no more public gatherings and stuff. So through the help of citizen journalists, we managed to generate content from those rural areas. I would say Gutu, Bikita, Mwenez, and Chirez. And I'm glad that one of our citizen journalists who is based in Chirez, Bitfe Gumwand, he was honored by Deutsche Welle. That was around September last year for his telling work about reporting issues about COVID-19 in the Chirez district. He was the first also to break the news about the first death of COVID-related case in Masvingo province. Then also through the use of citizen journalists, we also managed to write issues about self-delivery, issues about how women and youth were living during lockdown. We've managed to profile some women from rural areas such as Gutu and Bikita, as well as Buhera and Chipinge in Manicaland province. Also, we also managed to try and get hold of some of the survivors of COVID-19 to share their stories. And in so doing, we've managed to profile and interview a female teacher from Gutu district. We also managed to track a woman from Bikita, and we interviewed where they shared their experiences and issues of neglect. They also came out prominently, where one of the survivors said they had no food and they were getting little assistance from the government. Also that they had no enough space for self-isolating at their homes. So I think maybe in short, those were the major issues that we managed to cover during the COVID-19 pandemic and lockdown in Masvingo and Manicaland province. But I would want to emphasize that for us as tourism, the use of citizen journalists, it helped us a lot in reaching out to those marginalized areas, in also covering those issues that were happening in rural areas where we had no access before the pandemic. Thank you, Luna.
Thank you, Pasmo. I would like to hand over to Comrade Mzengi. He's got a guest that he wants to introduce, representing academia. You can go ahead, Comrade Mzengi.
Thank you, Lennox. We have been joined by Dr. Mungwari. He's from Chinhoyi University of Technology, and he's contributing from the Media Center Computer. So I will give him the floor without wasting much of our time.
Okay, thank you. You go ahead.
Hello, good morning, everyone.
Good morning, Doctor.
Thank you very much. I just have a few ideas to share with our colleagues here. I've been listening to the presenters before me. I want to highlight a few pointers on the experiences we've had since COVID-19 pandemic, 2019 to the present. First, I want to talk about opportunities and challenges faced by universities in Zimbabwe in administering teaching and learning on virtual platforms during the COVID-19 pandemic. You'd realize that when COVID-19 struck the entire world, Africa and Zimbabwe in particular. Nobody was prepared in terms of how to manage situations. It was just something sudden and unexpected and unwelcome as well. And so universities and all learning institutions, tertiary, I would begin from I would just highlight that all learning institutions from preschool, primary, secondary schools, then you go to tertiary, teachers' colleges, polytechnics, then universities. They've had challenges, and there's still challenges to grapple with. And I would just want to highlight a few things about universities in Zimbabwe, how we manage to, how we are managing in terms of the challenges and opportunities as well. When COVID-19 struck, it was a challenge for faculty, that is the academics, even the management, to now say, what's the way forward? We're now, government said we are going to stop delivering our lessons or our lectures face-to-face, the traditional face-to-face mode. And so we went on lockdown. And so for teachers, administrators, and management now to talk about teaching online, virtual learning, teaching, and virtual teaching and learning, it was almost something strange to many universities and faculty. And so there were so many things in terms of how to cope and how to manage managing the classes, large classes. Students were scattered all over the country. And I would just want to say that many a time, many parents, many guardians who had children in universities, they decided to send their children in rural areas where it was thought that it was safe then in terms of contracting the pandemic. So it was now a challenge for teachers, faculty, to access and manage students who were far away. Many students didn't have gadgets such as smartphones. Not only smartphones, they very few would afford tablets or even laptops. Just the challenge of gadgets. Now, in terms of data, it was even a more bigger challenge. It was a huge challenge both to the faculty, the lecturers, and also the students at large. And even the internet access was very difficult. And so you'd see that even in terms of standards then, in terms of assessing the students, coursework, delivery, giving the adequate, appropriate, course material for us to have course content, the 30% in terms of assignments, in-class tests, and so on, all those were difficult. And so even the examination, I would talk even the examinations, the first examinations around June, July. Many university they to stagger the examinations because students, the idea was to decongest the campus. So students were coming in batches. Few streams will come and write, and there were challenges then, and so. The challenges still continue even when we were trying to have the second semester. Many students again would not afford to come or to have lectures online, whether it was on WhatsApp or whether it was pre-prepared, pre-recorded lectures. And all those things made learning very difficult. It's making learning very difficult. But I want to say that there is something to recognize that Zimbabwe Open Invest, though, it had its usual mode of delivery as online largely. And so though it did not face so much surmounting challenges than other conventional investors, we relied previously on face-to-face. So Zoe continued with their online. They did very few problems because they were used now to teach online. I'll give an example that they have lecturers will send lecture notes, delivery material on their virtual platforms, and students again would access the information. So they would have normal lectures online. But the majority of state universities and even private universities, they were used to face-to-face at a serious problem than the Zimbabwe Open Invest. But I just want to say that this year, we're supposed to open, but we are yet to be informed when are we supposed to have lectures, when are we supposed to have examinations, because the examinations were supposed to be set mid-December last year, they were postponed to mid-January. And because of the new lockdown measures which were announced by government, so it shows that no exams in January. So we are yet to wait when the examinations are going to be written for last semester. Then when we are going to open again for this semester, we are yet to know. No one knows when the government is going to say we are going to open, and whether the COVID is going to allow us to do that. So much on that one. I want to say my last contribution is about fake news. When COVID-19 started, unfortunately, many people they had excitements to post news on different platforms, whether it was on the mainstream media and also social media platforms. And so the main challenge was that there was this tendency, and there's still this tendency, unfortunately, that people just post disinformation, misinformation, half-truths, and also accompanied by conspiracy theories. And I think this is not very well for the country and for the nation and the entire world in particular, because the society is supposed to be informed and educated on the truth, the actual things which is happening, rather than misinformation or disinformation. And so I think we call upon all citizens and the media practitioners in particular that we need to observe ethics. Ethics is very important. It's key in terms of our delivery, so that our media content is going to be trusted by everyone in Zimbabwe and the region, also the entire world. So I think let's try to be very ethical in our reportage. And I think there's no need for anyone to be excited by any deaths, because I think we've seen that there are so many posts which are on social media, people waiting to see who is going to die next, and so on and so on. I think we need to go back in our values and tradition to say, whatever death, the person, whatever their positions in life, whatever their political affiliation, we need to be very sympathetic about death. And so we need to be, just like everyone is talking about, we need to be united more than any other time, this time around, so that we flatten the curve. Thank you very much. That's my humble contribution.
Thank you, Doctor, for that perspective from the academia side. I might say that I've also experienced the problems that you mentioned as a part-time lecturer at Bindura University of Science Education, where in an exam that was written a couple of weeks ago, out of 12 candidates, only one candidate sat for that paper because the rest were scared of contracting COVID. So we don't know what is going to happen for the others, the genuine reasons why they didn't want to write. So it's one of the challenges that lecturers face, in this environment. At this juncture, I think I will open the floor. You can raise your hand, and I can indicate whether you can proceed with your contribution. We have had quite a number of perspectives here, and what is coming up very clearly is, for instance, the aspect of the coverage of community news, or the communities are under covered. We have a high concentration of news coming from urban areas, and we have a lack of appreciation of what is happening in the communities. And yet, that is where the majority of our people live, and we might not be able to appreciate the extent of the pandemic in those areas. It might as well be worse, like the good doctor has said. And also, Pastor has also mentioned the aspect of the number of deaths that are there in the communities which are being underreported. Comrade Mzengi, you can proceed with your contribution.
Thank you, Lennox. Maybe my question would go to Dr. Mngwari and Mr. Rusike there. I think you have brought out the fact that the media largely lacks issues like statistics and so on and so forth. Would you say that it is easy for the media to get such information considering the current environment? And maybe also, you may also want to suggest how the media could be able to become more diversified in its coverage of COVID-19, considering constraints such as economic constraints. The media really has been a victim of the economic meltdown in this country and so on and so forth. And they are finding it very difficult to even cover outlying areas. I know Passmore talked about the citizen journalism and so on and so forth. But maybe beyond that, from an academic perspective and maybe from a community health perspective, may you, Dr. Mngwari and Itai Josh, just maybe suggest some other ways through which the media can diversify its coverage on COVID-19.
Hello, I'm back here. Thanks,
Yes, Doc.
Mr. Mzengi, for the question. If I may just remind you and everyone else that last year, 2020, when COVID-19 struck in March here in Zimbabwe, initially, I think you would appreciate that initially there were so many people or avenues which were reporting statistics in terms of infections. They were early enough, there were no deaths then. And so I would give an example that, Harare cancer, yet the doctors there and also representatives who would constantly inform about the infections and so on, what was happening in the local clinics and so on and so on. But at some point, government had to say, we can't allow anyone to report about, in terms of statistics, infections or deaths, because the government's position was that through Minister of Information, I'm sure, they wanted the report to come from one central venue, which is Minister of Information and maybe I think Minister of Health, something which is well coordinated, so that they wanted to avoid, I think, variance or disparities in terms of statistics and so on. And so up to now, it's only, I think, through Ministry of Health, through Ministry of Information, which are giving daily updates in terms of infections, in terms of deaths, and what is happening and so on. So I think given that scenario, the first present, I think it was, I think it was Itai Rusike who said that we gave some examples of studies saying officials official statistics seem to be grossly underreported because it talks about testing capacity and no proper documentation is happening in different zones and areas, rural areas, communities, farms, and so on. And I think what is very important is that government should acknowledge that their testing capacity is a bit limited. And so the statistics they are giving on daily basis, they're based on a few cases they would have managed to test, whether it's from Harare, Blawayo, or whatever, Senate, and so on. But saying they just say these are estimates in terms of what has been tested, so that people have a clear view that COVID-19 is real, despite the statistics which may be presented officially by government. And let me just say on that point, I think at some point in Zimbabwe, there was negative attitude in terms of people putting on, following guidelines, World Health guidelines, such as fully masking up, social distancing, sanitizing, and avoiding crowds, avoiding parties, and so on. People have been so almost like lax in terms of attitude, because the statistics to them, they said, if the statistics in the entire country is just less than 500 who are infected, or there are less than 300 deaths, we are about 15 million in Zimbabwe. So what are the chances in terms of probability for me to be infected? So in terms of statistics, I think it determines again our attitude. Until recently, just the past 3 weeks, the so many deaths have been recorded, and statistics have been just going up like that. And so nobody needs to be reminded now in the streets or wherever about the fully masking up, avoiding crowds or even parties and so on, because people have noticed that COVID is real. And so I think, in terms of media, to report statistics, they still need to liaise with the ministry which is in charge, so that they report independently from Minister of Information, because I think that might give a misunderstanding to say, I think you are no longer following the procedures and so on. But I think what's very important is that we need real statistics, proper documentation, so that people would really see the impact of COVID-19 at the present. And those who are even calling for, say, schools must be opened now, or exams which are in progress should stop and so on, I think they need to be informed from a real point of view, based on statistics of what is exactly happening. Thank you very much.
Thank you, Doc. I think you bring out two very important points there. I think the element of the lack of capacity in terms of reporting on statistics and data journalism. We need our journalists to be well equipped in data journalism, to be able to mine the data that is available out there and present it in a way in which our communities will understand. And that would require, of course, funding. And it's an area that perhaps as Media Center, you could push that. We have some fresher courses around data journalism. But the other element, of course, is access to information. And Zimbabwe is one of those countries that is very difficult in terms of accessing information, especially with government departments and ministries. And that is an area again of where we need to lobby, government departments, government ministries to avail such statistics. In fact, people now are beginning to question the statistics that are coming out of the Ministry of Health, because they're saying there are people dying in the rural areas. Are they included in those numbers that are coming out? So all these things have to do with the element of capacity and also the element of access. Itai, do you have something to add on to that, to the question that Ernest Mzengi asked or forwarded to us?
Yes. So given that we have got questionable statistics, what it means is that we have to treat everyone as a COVID-19 suspect. And it is also equally important that maybe the media, working with civil society organizations, we need to step up our advocacy for the government to invest in its testing capacity. Because, in the absence of correct, statistics, it then becomes very difficult to tell the current situation on the ground. So it is our duty as the media and civil society to make sure that we continue to push the government so that the government invests in its testing capacity. But it is also equally important that we also learn something from the cholera crisis of 2008 and 2009. I'm sure you are aware that during the early days of the cholera crisis, there were also similar challenges whereby the government was being accused of massaging, the figures. And even up to today, no one knows the correct figures of people who died, from that cholera crisis and the people that were infected from that cholera crisis. But unlike the cholera, crisis, as civil society during that time, we had the community monitors on the ground, and our monitors were sending us figures. And then when we said to the government, we are going to also have a parallel process where we'll also be sharing, figures that are coming from our community health monitors. We saw the government started, coming out and issuing out, the figures, disputable. But what it also shows is that the government also has to come out openly. I'm not sure why the government is so much concerned about, some people also sharing what is happening in their communities. Because the government may not be able to reach certain communities, and those communities can also share to say, in our township or in our village, we are also having these deaths and unexplained deaths, and we suspect that these deaths may be, COVID related, and we have a mass movement of volunteers in Zimbabwe. We have community health workers almost in each and every ward, each and every village. And those can also be utilized to support, the system in terms of collecting, such information on the ground. But I think what is important is for the media to continuously interrogate, the state in terms of the figures that they are sharing. Because when you go to any community right now, people are saying, you are saying only so many died, but go to the funeral, cemeteries, and see how many people are being buried as COVID-related, deaths. You go to our funeral parlors, they are completely overwhelmed. You go to our mortuaries. So what is happening on the reality on the ground and the figures that are being shown, unfortunately, they are not matching. So we need to question that. We have a right to know to what extent is our problem as Zimbabwe. Because right now we look like we are doing better than other countries. But the reality is that we are in a situation, and a lot more people are getting sick, a lot more people are dying from COVID-19. And there's nothing wrong with the other structures being incorporated to support with data collection and making sure that at least we show an almost a correct picture of the reality on the ground.
Thank you, Itai. We have another hand up, identified as Galaxy A50. If you could introduce yourself and make your contribution.
Good morning, everyone. I'm a media graduate.
Yes.
I just wanted to, maybe this is directed to Mr. Ruke.
Okay.
Looking at citizen journalism, how can we say it's that reliable? And also looking at the ethics, what's your comment about it, looking at what Simba Chikanza did from Zim-I with Opam Chinguri?
Okay, Itai, you can respond to that, and maybe Vivian as well.
My experience working with the community level cadres, even in terms of the angle that we are bringing of citizen journalists, I think generally people would want to be as genuine and as honest as possible. But sometimes because certain, individuals may not have the necessary, training in terms of, what is expected of citizen journalism. So without the technical training of understanding, what can be shared and what cannot be shared, it then becomes a challenge. But what it also calls is if those qualified media people, if they are working with the media people also at community level, make sure that those are given the necessary skills and capacities, so that whatever that they share should also be factual, should also be able to be verified, and so forth and so forth. But we have seen a lot of community monitors on various aspects, whether they are monitoring health services, whether they are monitoring food security, and so forth. Some of them have been very useful in terms of sharing information that can even help the government in its responses. So the same can also apply to citizen journalism.
Okay. If Vivian, can you come through on that one? Is she still around? Yes, Vivian.
Yes, I am. Maybe if she can just repeat the question. My connection had gone.
Okay. You can repeat your question.
Okay, I was talking about citizen journalism. What your view would be, considering what Simba Chikanza did from Zim-I with Opam Chinguri. I was talking about the ethics and how reliable citizen journalism is.
Okay, thank you so much. I think the challenge that we are presently facing as the media in Zimbabwe is that the coming in of online platforms has posed a challenge when it comes to the dissemination of either disinformation, misinformation, fake news, and also this issue of clickbaiting, where somebody tries as much as they can to attract as many likes as possibly they can attract. So the challenge that we currently have is that we do not have any means of regulating citizen journalists as a country or the world over. The internet has provided an opportunity for citizens to also be at the forefront of not only being news consumers, but also content creators. So the onus now is on an individual to decide to adhere to issues related to accuracy, balance, fairness, and the likes. Because when you look at ethical considerations, you'd note that because media has been, media practitioners have been trained on the ethics of the profession, they are more inclined to adhere to such. But it's now it's a challenge when it then comes to most online platforms, which you find that in some instances they are being manned by citizen journalists and the likes. So it's indeed a challenge when it comes to trying to assist or regulate the operations of citizen journalists. But I do have to say that there were some concerns that were raised regarding the manner in which Simba conducted the interview, and subsequently organizations such as the Media Alliance issued a statement to that effect on the need for adherence to ethical considerations of the profession. But like I said, there are still challenges that are posed by the coming in of online platforms, because issues around regulation still remain a challenge. Thank you, Lennox.
Thank you, Vivian. Yes, the issues around ethics, ethical behavior of journalists is very critical, because we actually place ourselves in the line of fire of government, who still insist on a centralized form of control of the media, and yet we are pushing towards self-regulation, or a hybrid of the two, where you have a self-regulation and also the government coming in with ZMC. But if we find that we have organizations or colleagues who continuously breach ethical standards, we push ourselves towards government actually coming down on us with a sledgehammer. Yeah, exactly. Pascal, you had your hand up.
Yes, I want to agree with what Vivian said, but also I think also citizen journalists can be put into good use if they are trained and given basic journalism skills. Usually you have to maybe target a certain group. Maybe if you're targeting youth, maybe you train them on just basic journalism skills, the news values, the ethics, so that they act as content creators. Like in our instance, we use them to create content. They give us evidence-based issues. For example, if they are saying there has been an issue here, we say, do you have pictures? Did you manage to maybe to take a short video? Can you send it to us? Then it is now the duty of professional journalists to flesh up those bits and pieces that would have been brought up by citizen journalists. So it all depends, but if they are not well managed, again, we have to, that's when we have challenges regards ethics, and because people these days, sometimes they are always in a hurry to break news. So sometimes if they have access to online platforms themselves, they end up abusing those platforms. But if they are well managed, I think they are very necessary in terms of giving information in real time.
Thank you. The other element that keeps on coming up is that of funding. Funding for such kind of training that Pasmo has alluded to, capacity building and so on. We still find ourselves in a bind in terms of how we can source that kind of funding in order to embark on capacity building programs. Comrade Nzengi, can you share with us on that aspect? Go ahead, Comrade Nzengi.
The issue of funding is a difficult issue, which is why I think we are not having investigative journalism. I think some of the issues raised by Itai and also by Dr. Mungwari have to do with the investigative journalism. We don't have the capacities in terms of funding. Yes, there have been some projects. For example, we are currently working with the Tell Zimbabwe and the other MAS, Media Alliance of Zimbabwe practitioners, to empower citizen journalists, and we are training them with the basic skills. But obviously, it's still limited because we can only reach certain areas like Kuzipa said, Manicaland, maybe Mashingo. Then you have your Marsh West and so on and so forth. And the issues of funding are difficult, and the investigative journalism has therefore suffered. So if I think we will be organizing more, I think a discussion around these issues. I think last week we had a discussion, I think, where who actually challenged the media and the government to actually come together and then plan something that can help, that can be funded. So I think those issues will be discussed further. I am happy Vivian is in this discussion. I'm also happy Patience is also here. These are prominent members of MAS. I think they are helping us to take those issues up. But I think what we need also is to come up with innovative ways, apart from donor funding, because obviously donor funding is not sustainable. We need to come together, maybe civil society and the media practitioners. Zine, if I'm happy, we worked on this together. We are going to engage further on how, for example, we can link citizen journalists with the editors so that their content can actually be published in mainstream media. That's one way. But the other issue, I go back to the issue that was raised by the student, Claudia. The issue of ZimEye, the issue of Simbachi cancer, it would seem as if online journalism, whether it is ethical or not, whether it is the one, the Tell Zimbabwe type, or the one, this fast, the ZimEye type, I think it has become more popular than conventional journalism, if I may call it conventional journalism. In fact, the truth has become faster than reality in terms of these issues. That's one problem we are having. And I would want maybe some of us, maybe we don't have much time to discuss around that. What can be done with this issue of popularized tabloid journalism, social media journalism, where those who try to bring in sentiments of ethics are actually looked down upon. Because I remember the discussion the other day between Rashwit Mukundu and Simbachi Kanza. The multitude of ZimEye followers were actually attacking Mr. Mukundu for pointing out that what he did to Obama Chinguru was not fair, was not ethical journalism. So I don't know what can be done, considering that these platforms have really become popular. Maybe Lennox, maybe Vivian and others who could answer to that.
Yeah, maybe I'll pass it on to Patience, because right now we are rounding off, and maybe we'll have closing remarks around what you have just said. Patience, if you could comment on what
What's happening? Network. Patience was about to speak on it.
Yeah, thank you very much for that. Mine is a quick one. I just wanted to talk about the issues of fake news and also content creators that try to create more followers through sharing information which does not have verified facts. I think this is a call for traditional, if I may say, traditional media and journalists to be always ahead in trying to counter fake news, especially during periods of pandemics, like the situation where we are in today. Because so our role, I think, is also to try and bring facts and also to counter fake news so that the community or the public that we feed are able to distinguish between a proper report, or they are able to find value in our existence. Because at the end of the day, we have a community or a public that are now starting to develop a negative attitude towards journalists. They say maybe journalists write this, journalists lie, journalists break ethical considerations and so forth. Whereas we are just talking about maybe someone who has an access to a phone and he just type something and start to forward in WhatsApp groups, and people call that journalism. So I think this is a critical moment where we should be able to be ahead in terms of technology, in terms of our facts, in terms of our sources and people that we work with. If need be, like what Pasmo has just said, that probably you have angers, you have people around that can help to verify certain things and to come up with factual stories always. Otherwise, we end up confusing the people who are supposed to consume our products. Thank you.
Thank you, Gordon. Yeah, that is a very pertinent point. In actual fact, that our profession actually has a reputation crisis in terms of the manner in which some of our colleagues actually report. And then, of course, you brought out the element of fact checking, which is very important. Fact checking and ensuring that before publishing any information, it is verified. And I think that actually opens an opportunity for the organizations represented here to organize another discussion around that, around issues of ethics, how we can counter misinformation and fake news. Because that is very critical. It's critical for us as a profession. It's critical for the communities that are out there. And I think, we've really covered a lot of ground, and I'm quite sure that with the information that we have, we can move forward and as the people who are wiser. And obviously, this is a new situation. The pandemic is unprecedented. So as a result, a lot of the things that are happening to us are new. But it's how we manage the crisis as a profession and how we play our role as frontline workers who are also exposed to the pandemic itself. For us also to be careful, for us also to have all the necessary documentation, all the necessary information that is there about the pandemic, and to assist the national thrust towards tackling the foundation. I think at this point, then we will have to wind up the discussion and take this opportunity to thank all of you for making time to discuss, these very important issues, and for us perhaps to think about what we can do in the future moving forward. Like I said, there are elements of ethics that we really need to tackle, and also issues around resources, whether it's information, whether it's financial resources, and how to capacitate our colleagues. Thank you very much for your time, and I think we will call it a day. Thank you, guys.
Thank you, Lennox. Thank you, all the colleagues from TEL Zimbabwe, Patience, Vivian, Itai, Josh. Thanks for coming. It was a short notice, so we meet.
Thank you very much, Ernest.
Thank you.